Thank you for coming. We really appreciate you coming. And the biggest step, I feel, is most important is education. And the first step towards health is your desire and willingness to learn. And I feel like all of us, even us in the medical field, are always learning. Okay? Should we get started? Okay, great. But traditionally, what we've seen is that a healthy cycle usually evolves around a 28-day average cycle. Okay, now our norms, based on what we've seen from a population scale, is that that can change. It can be as early as 25 days or even as late as 35 days. So generally, anywhere between a 28 to 35-day cycle is what we in the medical field would say is a normal range. And if you're not within that, and if you're at 36 days or you're at 22 days, that person, as long as that is a healthy cycle and that's normal for you, means that nothing to worry about. Okay, and we'll talk about if there's any changes between there, but we'll get into that. So I hope I changed that myself. So this is exactly the same as the picture before. It just breaks down the timeline of what your cycle will go through. And we'll kind of go about this in more detail as we move forward. So when we look at your menstrual cycle, typically the first day, highlighted in blue as day one, obviously we can all see that, is traditionally we reference that as the first day of a woman's period, right? As we commonly speak, is when you start having what we call a flow, or when you first notice spotting or vaginal bleeding. It's okay, I'm on my period, right? That's what we traditionally. So from that standpoint is what we consider day one, okay? And so going through the process, the first average 5 to 7 days, and once again, that's just a population-based number. Some women may have 2 days, 3 days, some might have 8 days. But generally the first 5 to 7 days is what we expect a normal female's flow phase, what I refer to as a flow phase, which is what we call a period, what everyone's familiar with. And so from that standpoint, we move on to the next phase. So once you had finished that flow phase, we move to what we call a proliferative phase. And I'll go into that a little bit more detail, but it's just a rough outline, is that from 8 to 12 days is when the body starts kind of over again, is in the sense that, okay, when you start puberty, generally around the age of 13 to 15, depending on how our lives advanced or with technology and with the future, generally 13 to 15 is when the body starts preparing themselves for the ultimate childbearing status, right? It's okay, the body was designed that starting around that age, we're attempting that sooner or later, we're gonna start procreating or starting having a child. So starting around day 8 or 9 is when the body or your woman's body starts to say, okay, we're going to start again. We're going to see if this time, let's prepare ourselves that maybe we might have, a baby. So that's kind of takes us through that phase. And there's certain hormonal changes that we'll get into. And so between 8 and 12 is your body's going to start developing. The chances are, okay, let's prepare ourselves, or let's prepare the area to be prepared that if there is a baby, then we can be ready to care for that. And so that's where days 13 to 15 is when a woman's body releases that egg, hoping that there will be a sperm available to then fertilize to create a child in that area. So post that, depending on if there is fertilization or not, from day 16 to 28 is when there's going to be that second phase where you're going to prepare to continue that pregnancy. Okay? Now, the reason why I wanted to stay on this slide is that from a pregnancy standpoint, and then because this is the only slide I have with the numbers, is kind of skipping ahead here, is that let's say if there is a female in the audience or online, is that they're like, okay, well, which days would I be? I'm looking to get pregnant. I want to get pregnant. Where can I think that, which time frame is it possible that I have the greatest chance to become pregnant. And we're skipping ahead here, and I apologize. So typically they, once again, each woman is different, but based on a population standpoint, we have come to the conclusion that the most likely time is between days 11 to 13. That is when it is most likely that you're going to ovulate. And for those who are looking to become pregnant, non-medically speaking, I would say, okay, you and your partner, that is as much time as you possibly can to have together, spend that time together, because that will be the most likely time that you have the greatest chances. Now, days 13 to 15, once again, you're right in that great area. And then moving from 16 to 28, it's still very likely, but obviously when you go towards days 23 to 28, your probability of achieving a pregnancy in that time frame is much lower. Not impossible, but much lower compared to days 12 through 15. That being said, the opposite standpoint is, okay, well, don't want to become pregnant at this point. I'm not ready to use any type of hormonal replacement or any type of birth control or anything like that. And that's very, very common in my practice as well, is about natural family planning, meaning that, we are happy with our life the way it is. We're not ready to have a child. Where is it that we would not want to engage in activities that might increase our risk of pregnancies? And that would kind of fall in that same standpoint. 11 to 15, once again, that is the most special area where if you want to either achieve a pregnancy or stay away from pregnancy would be the most specific time frames. But so when we think about your menstrual cycle, moving past the days, is we want to think about, okay, well, what is happening? What is the cycle related to? And we think of the cycle, there's actually two parts of it. There's the cycle that affects your uterus, and there's the cycle that affects the ovaries itself. And it all actually stems back from an area that's very distant to those female anatomy, and that is up in our heads. And so I'm going to use my mouse here and see if you can track me along. So this area here is your pituitary gland. And so even stemming back from that, which is located in our heads, is we're always producing a hormone. And the hormone not necessarily is constant, but it creates what we call pulses based on your cycle or based on the number of days in the month. Is starting off from, let's say, day 1, for example, and I'm going to have to kind of explain this a little bit, is that if we relate to day 1 being the first day of your menstrual flow, your flow phase, is that the body did not achieve a pregnancy, so at that point your body understands that, okay, well, my hormone levels dropped, and we'll get to that, and so I can understand that my body did not achieve a pregnancy. And so in that situation, your hormone levels drop. They can't maintain the lining because your body has realized that it has not become pregnant. And so you shed that lining. So from a hormonal standpoint, your hormones drop. Okay, and that causes the flow period, or your period basically. So let's say from days 1 to 7, that stops. So now starting on day 8, once you have that lack of estrogen, is that when your body is going to say, okay, my brain's going to be like, okay, I need to start producing again. My body's going to now trigger to the point where my hormone levels are low, and it tells the brain that we need to start reproducing, because I'm like, okay, I'm going to meet that second cycle again, or I'm going to reach that point where my body's going to try becoming pregnant. Basically, your body's trying to become pregnant without knowing what your status is as far as relationships or where you are in your life. And so this part of your brain here is what's responsible for creating those initial hormones to prep your body for pregnancy or prep it for ovulation. And so we think about two main hormones here. So you have one main hormone, initially that comes from the brain, and then it stimulates two areas. One, which is your ovaries here, which are these little structures here, and then it also stimulates the lining of the uterus, which is this area here. Are you able to see my mouse and track that accordingly? Okay, great. So moving back to these areas here. So from the brain, you create this main hormone that tells these structures to secrete or release hormones, both what we're familiar with, which is called luteinizing hormone, which is LH, and something called follicle stimulating hormone, which is called FSH as well. And so they both act on both the ovary and the lining of the uterus to prepare for a pregnancy. So that's kind of what the cycle is primarily affecting. So we think about two different areas. There's the ovary that is going to stimulate an egg at the end of the day, and then also the lining of the uterus called the endometrium, which was going to house or prepare a soft landing to embed the embryo and then eventually become a child. So when we think of the first phase, and this is going to be related to the ovaries itself. So from this standpoint is that you start having your period by day 7, by day 5, by day 7, by day 8. When you are completed from the flow phase is when you're going to start having stimulation of the ovaries to say, okay, first time around, we didn't achieve that child. Okay, so we're going to start again. All right, now let's tell the ovaries is we're going to start creating follicles, and we're going to mature the follicles. And so that's where that estrogen, you start having an estrogen surge. And so with that, you're going to start, from a biological standpoint, is you're going to tell the ovaries that contain your follicles to start maturing. So depending on, they say on average perhaps 3 to 5, sometimes even 6, up to 6 follicles can potentially mature each cycle. And so by day 14, as I mentioned on that initial slide, is that you have a huge surge of a specific hormone called LH, luteinizing hormone. That's what's going to cause the most mature follicle to essentially break free, release into the fallopian tube to become available for fertilization, or to, if there's any sperms hanging out in that area, that's what it's looking for. So moving back here, that's where that day 14 is important. And just kind of skipping ahead here is that if a female is interested in finding out, okay, well, which day of my cycle am I ovulating truly, is now with technology in doing lab work, we can actually find that out based on what level your LH or luteinizing hormone is, or even a progesterone level. So that can also give us a good idea to say, no matter what day of the month that you fall into, whether it's the mid, whether it's early, whether it's late, can give you a good indication of, okay, well, this is generally my 14th day. This is when I'm ovulating. This is the most important time if I'm choosing to become pregnant, or this is a no-no time where if I don't want to be pregnant, I shouldn't be engaging in any activity. So not only is the estrogen important as far as maturing a follicle, it also causes what we call atresia, or it helps suppress other follicles from maturing as well. And so that, I think, is more so because of the fact that it wants to be able to give the best chances each time as far as allowing that most mature follicle to break free and to rupture. That leads to the most successful pregnancy overall. And so moving forward past that 14th day is, if there isn't a pregnancy achieved, the follicles then to start basically I hate to use the word disintegrating, but that's what I can think of off the top of my head, is they start to basically disintegrate or kind of, I would say, slough off in that sense, that they're not needed at this time. So that's what's going on as far as the level of the ovaries itself. And so the next phase is the area here that we're talking about as far as the uterine cycle. So in this situation, we're referring to the lining or the outermost layer of the uterus, which is the endometrial layer. And that is what is becoming either what we use the terms hypertrophy or hypertrophic, meaning that it's becoming thicker in order to create a nice cushion and a protection for the embryo or the child, eventually becomes a child. And that also is the flow phase, or that's what's shedding when when women have their period. But so when we think about the uterine cycle, same situation. We have that estrogen that's climbing from days 8 through 14, and even beyond that if pregnancy is achieved. But if you look at this area here, I apologize for the graphic, but this represents your flow phase. And then with that increased surge of estrogen, as your body's trying to say, okay, we're going to prepare for this pregnancy, we're going to start increasing the thickness of the lining. And so that's kind of where we're at by day 14. And so we have this LH surge that basically says, okay, we're ovulating. That most mature follicle is going to come out and release as that egg to say, okay, I am ready. Where's my sperm? We're going to have that pregnancy. And so if there is not a pregnancy, to start out, if there is not a pregnancy that is achieved, that LH is going to fall. Your progesterone is going to fall, and that's where you're going to have shedding of the lining because there was not a failure, I don't want to say failure, but there was no pregnancy achieved. In that sense, your hormones are not required to stay elevated. It's going to start to drop, and we're back to that cycle here where we're going to start back at day 1. So generally, day 14 is right down the middle. If there is no pregnancy, days 15 through 28 will then cause that cycle to return back to day 1, is where the lining sheds and we start all over again. And so, let's see here. Okay, so I will stop here. So let's go back, if you don't mind, to this slide here, day 1. So once again, depending on how a female wants to look at her cycle. If they say, well, typically why we use day 1 as the first day is because it's very reliable, because that gives you what we call an objective. It's not based on how you feel, but you have visualization that, okay, I started my period today. And so that gives us the best day. Then we can count the days of when you start your period and when you stop your period. So typically, if it's by day 5, then that would be, the next day is, okay, my 6th day. So if I count 7, day 6 is on a Thursday, that most likely your best likelihood of having a pregnancy is that following Friday, Saturday. And very often, and it has been proven by evidence from research, by trials, is that if women would like to do family planning and not use any other what we call exogenous or something that they have to either insert or take on a daily basis to prevent pregnancies, it's been shown to be very reliable that if you want to do family planning, that it works really well, and as long as you plan accordingly based on the timing of your period. And that's why we use day 1 being the first day. So from between day 1 and day 7 is you have a drop in those hormone levels, is what allows that shedding to basically drop. And then from starting on day 8 is when you have your hormones start to kick up again, saying, okay, unfortunately we didn't achieve a pregnancy, but let's try again, and we're going to start increasing that. And so that's probably from day 16 through 28. That's what the most variable time as far as how a woman's cycle may differ in that sense, is that it's possible that after 5 days, your cycle might be short to day 25 and you restart that. So as long as that your cycle is between, average 25, even 20, they say 28 to 35, it's still normal. You don't always have to be, well, I'm regular, as in it's always the same day of the month, and it doesn't always have to be. So now that we are familiar with how a female's menstrual cycle is known to evolve and develop, I thought it would be important to know, okay, well, we know now what's normal. So the next step is, okay, well, how do I know that something's wrong or what's abnormal in that sense? And so two big topics I would like to move forward to is, one is when we're not having a period, okay? Why is it that we're not having a period? Is it normal not to have a period? So amenorrhea is a medical term basically saying that we're not menstruating. I'm not having my period. What's the matter? So when are there times that are normal? Well, the top three, obviously before you undergo puberty, we don't expect it, and we should never expect someone to have bleeding. And so depending on the timeline, puberty generally is defined as when, in respect to a female, is when you start seeing breast development, basically. Okay, as far as, that doesn't mean that there's full breast development, but when you start seeing, what we call buds or initial signs of breast development. So generally within 3 years of breast development is when we should typically see a young female start experiencing their first period. If within 3 years or by 15, it's not concerning at all, but that's just the general time when we would expect a female to start having a period. Now, there are times when, although you might pass that age, it could still be considered not necessarily normal, but not alarming. So if you're 16, if you're 17, and you haven't had a period yet, it's not a cause for alarm, but might be something to be aware, or parents to be aware, and have a discussion with either your counselor at school or a healthcare professional. And so, once again, before puberty, it's normal not to have a period. When you're pregnant, you definitely should not have a period. And also when you're breastfeeding, and that's all has to do with hormones. And also after menopause, when you're later in life, or when I say more mature, after your body feels that, I think we are ready to move past the childbearing age, that's normal. I'm going to skip the bottom part because we kind of went through that. Menstruation requires a normal anatomy and a functioning hormonal system. So when we think of amenorrhea, or basically I'm not able to, why am I not menstruating? We kind of split that into two types. The first type is I've never had a period. We call that primary. Okay. Versus secondary, meaning that, okay, well, if I started having periods when I was 13 or when I was 15, and now patients have come to me when they're 18 or when they're 21 or when they're 32, and they're like, my periods have completely stopped. We call that secondary, meaning that you did have a period at one point and now you're not having that. So these slides represent if I've never had a period, and these are usually more so when we have younger females, once again, 16 through 21 that come in. And so we get concerned by the age of 16 when a woman has not had a period yet. And so we think about multiple situations. One is, is there a anatomical issue? Is there a hormonal issue? So I'm just kind of, there's a lot of information on this site, or I'm sorry, on this page, but I'm going to kind of walk through this a little bit faster in that sense. But when we think of, okay, I've never had a period before, primary, we think about hormonal changes, as I mentioned earlier. And so the most common is something called Turner syndrome. And so basically that's more of a chromosomal abnormality. At this point, it's not something we need to talk about in detail. It just gives us as physicians an idea that what do we need to start looking for. So I'm just going to move forward here. This is a structural issue, once again, relating to I've never had a period. And so from a structural standpoint, this has to do with in utero when a child is becoming, formed in mom's belly. We look at certain structures. And so that's another possibility as well. And so the third possibility is, although rare, there are a couple examples. It's basically what happens is that the hormones in this situation do not respond typically that we would. So there's something called androgen insensitivity syndrome. So basically this is really rare. This is more so that chromosomally the child is actually a male, but the structures do not respond to the normal testosterone. And so they do not, develop normal male physiology, but they develop all these secondary characteristics as a female. And so one very common, very famous person is Jamie Lee Curtis. And I'm not sure if you're familiar with her or not, but she was all in the Halloween movies younger, but I might be aging myself at this point. But that's another possibility. And that's not something that we have to all become worried about, that, and I say this because I don't want to cause any alarm, but I don't want a 16-year-old who's not had a period to think, am I really a man or am I a male? Very unlikely, but it just causes an awareness as a physician or provider to say, we need to maybe consider these possibilities and do some non-invasive or very minimal testing to just rule those out. And so those are the most common reasons why someone who comes to us saying, I've never had a period, from a severity standpoint. Now, some I haven't listed is when we think normal is 16 through 19 through 21, or someone even past 21. And very commonly we look at it as if they're very active, if they're fit, if they're marathon runners, or if they're volleyball players, softball players, college athletes. That level of activity also affects estrogen levels. And so it's not a cause of concern knowing that they have that history. Very commonly, I've had several college students, sports players, softball players, soccer players concerned. And I commonly say it's not a major concern. However, by 21, and it's still favorable to at least have an exam and consider some blood testing just to make sure that none of the more severe issues is evident. And if it's not a source of concern for the person involved, then it's something that can wait on. Very common, like, well, I'm only 21 years old, or I'm only 19 years old. I'm not worried about pregnancy at this point. I'd rather just wait until I'm at that level. And so that's very understandable. And I say, you know what, most likely you are very healthy than not. You don't have any medical issues, you had no family history of any medical issues. Very reasonable to wait. However, if you in a very slim chance, there's always overlapping issues, is that if you want to get more thorough as far as that, to make sure that this is the case, that it's just because I am active, we can always do those things whenever they're ready to do that. So between that age, nothing to worry about. If for some reason, either yourself or you have family, friends, colleagues that you're concerned that their weight is an issue, very commonly if they're very thin, or if they are overweight, or if they have additional symptoms that we will talk through, that might require a little bit more investigation, or I would prompt to say, let's do some testing just to make sure that because that potentially can affect your desire if you choose to become pregnant in the future. So hopefully that kind of covers, okay, well, is there a source of concern if I've never had a period and I'm 16 or I'm 19 or 21 in that sense? So moving forward to, okay, well, here's an example. My periods have always been regular since I was 14, never had any problems, and to the point where I'm 28 and now my periods are just, they just stopped occurring. And so that's more of an alarm from a professional healthcare standpoint. And so when we think of what we call secondary amenorrhea, it's basically defined as no bleeding for at least 3 menstrual cycles, or those women who've had 3 cycles, regular cycles in the past. Or it's 6 months of not having a period for those women who've had irregular cycles. So when we think of that, obviously our first initial thought process is, okay, well, let's make sure you don't have a pregnancy, because the most common reason why women miss their period, or, and I'm sure is very popular in everything we hear and see, is I'm late in that sense. And so obviously the most common cause is a pregnancy. If you're not pregnant, then we think about what other factors or what other influences, and that's what I had listed as if there's significant weight loss. On the opposite end, if there's significant weight gain as well, and that's a whole different issue in itself. But if there's certain nutritional deficiencies, once again, as a college athlete or as an adult athlete, in the WNBA, strenuous exercise and even severe emotional distress, you'd be surprised, can also affect a women's natural cycle as well. One very common issue is, like I mentioned, as far as from a weight standpoint as well, it doesn't always have to be related to weight, but is something called polycystic ovarian syndrome. In this situation, this is very specific, but the cause of the issues related to cycles is unclear. We're not 100% sure as what the direct link is, but we know that there is an association to that. With polycystic ovarian syndrome, it's the fact that the hormones are just not well balanced. It's not that there's a deficiency. We actually are seeing that there's actually higher levels than what is required. The issue with that is that it's always at a certain level. We're not seeing kind of that surge and that drop. And so that's in itself a reason why. The most important issue is that once a woman ovulates, we're not seeing that rise and fall in the progesterone, which is a hormone important to maintain your lining for a pregnancy. And that's why there's no experienced period in that sense, or menstruation. Additional causes has to do with certain issues as far as the tissues that's responsible for secreting hormones for a natural cycle, or even the thyroid itself. So both the brain and the thyroid are also important factors, and that's what we look at from a healthcare standpoint. Another factor is the ability to either, if you do have follicles, or are they able to stimulate as well? So that's another reason why. Is if they're not either present or respond to the initial hormone, they can't help produce the hormones to mature or sustain the lining of the uterus. So that's another factor that we look into as well. And then other issues have to do with anatomical, as far as adhesions or scarring. More commonly, the scarring is more commonly seen after women have had pregnancies. And I hesitate because I'm trying to use the right words, in the sense that more likely it's when they've had failed pregnancies that might require instrumentation to help get rid of some of that excess tissue or retained tissue, as that's where we see the scarring is due to more so the process of removing tissue surgically. So those are more common issues. So when we think about causes of either not having a period initially or normally healthy periods and now stop, not having them, is we look at, is there any additional signs or symptoms a female may have? And so this kind of separates as far as primary issues. And so there's a lot of text here. I don't anticipate, you understanding each one, but it and these slides will be available, is that off to the left, I'm kind of going to just skip over that because that has to do with primary causes, but as far as purely people who've been born with anatomical or hormonal absences. But when we think of more commonly here in this area as far as functional areas, is that if you see those women who are low in weight or underweight, they have hormonal deficiencies, which is important as far as bone health. And so very commonly, if we've seen women who've had very subtle fractures from minimal injuries who are low in birth weight, gives us an idea that it's more the weight that's causing the lack of period. But that is more complex because people who have anorexia, emotionally, physiologically, they're very complex patients, or very complex. And so that's just a whole topic and a discussion in itself. But moving down is that if you see a woman who has an increased body mass, who might have history of diabetes, they tend to have higher levels of testosterone, and that's what's responsible for more facial hair, axillary, armpit, hair under the armpits and the legs. Polycystic ovarian syndrome, that's a very complex issue as well. Premature ovarian failure, that's more so when we think about what we call very commonly early menopause, when people have hot flashes, or if they have, very commonly difficulties with pain or during intercourse, or having a lot of dryness as it's laid out. It can guide us to say, could this be possibilities? But from a kind of overall aspect, it's worth talking to your doctors to say, if I'm exhibiting any of these signs or symptoms, rather than your provider saying, I think you're fine, let's just wait, to give you the knowledge to say, I think we should investigate. And it may not be the option your provider may want to jump right into, but once again, I think it also gives you as a female that right to say, I should maybe then look to see, is there a healthcare professional who I'm in agreement with? Because at the end of the day, this is your health, and if it's something that you're concerned about within reason, and this is what you want to pursue as far as additional testing, even to make sure that you're okay, I think you need to find that right person to have that good relationship with. It shouldn't be, I think you're fine, I'm out the door in 5 minutes, or less than 5 minutes. Like, no, I want to have this discussion. And so I think that's the most important aspect to that, is these symptoms can help you, but it doesn't always link to that. So if you have a hot flash tomorrow because you're out in the sun, doesn't necessarily mean that there's something wrong. But if you want to go through the investigation, I think it's important to find that provider that you're going to have a good relationship with. This moves more into helping us healthcare providers understanding what steps we need to take. And this is, once again, is the first thing, the easiest thing you can do if you've not had a period or missed a period, is get a home pregnancy test. Make sure that that's not the case. We're like, well, I know I'm not pregnant because I've not engaged in any activity, which is very commonly. And you know that you can always skip that step. But then the next steps are, as you can tell, doing some routine blood work, and even using an ultrasound by your doctor to just make sure that you have a normal female anatomy. And it's more advances in technologies. We can actually look at how many follicles a female has. And so that really helps guide us as far as which scope is, or which diagnosis or degree of diagnosis we can run into. And then moving forward is the treatment. Once we have identified that specific cause is where we can proceed with certain treatment options. And I'll kind of skip over that at this point. hopefully briefly I can talk about, okay, I've not had a period, and we kind of went through that, or I've stopped having periods, what are the next steps? So that was kind of a brief overview. And so the next topic is, what is normal bleeding, and how long should I be bleeding? Or is it normal for me to have this heavy amount of bleeding? And so those are all very important as well. And so the next step is that, okay, normal bleeding should last at most 7 days. Anything less than 8 days is normal. And they say up to 6 tablespoons is the amount of blood we should expect to bleed. That's what you're shedding, just the lining. It says the shortest and longest cycles don't vary by more than 9 days. And so, as we know, as we mentioned earlier, that the cycle repeats itself anywhere from 24 to 38 days. So my flow or my period should last 7 days, 8 days max. Anything past that should be causes of concern, to the point where you don't need to run to the emergency department. But as an emergency room physician, I've very commonly encountered patients or women in that setting, and it doesn't hurt. I'm not saying not to, but it should not cause much of an alarm. And then as far as 6 tablespoons, that's very, very important. If you are noticing that you are at any point, whether it's in your expected menstrual flow time period, or more concerningly, even outside of that, if you are having any type of bleeding or more than 6 tablespoons, or if you're going through more than 3 to 4 pads a day, would be more concerning. You want to go see your doctor about that. So we talked about normal, and we just jumped into what is concerning. And so briefly touching on that as well is, from an age standpoint, obviously before puberty, a child, unfortunately I'm going to call a child, is bleeding. That's very alarming. That's something that I would not wait. I would go into the emergency department right away and say, there's obviously something wrong. And also, what is abnormal is after menopause. Once you have established that you've had periods where, periods of wrong, you had time where you've had a normal, regular cycle, and by the age of 50, or we always ask, how old was mom when she went through menopause? 45, 55, 60, around that time frame, we can safely assume that. So anytime after that you start having bleeding, that's causes of concern as well. Other possibilities is frequency and regularity. Cycles occurring irregularly, whereas in the sense that, I had my period lasted, 7 days, and then I didn't have another period until day 40 or day 50 or day 60. Those are more concerns. But if it's, 36 days, and then it was 24 days, and then 36 days, then 30 days, as long as it's within that 24 to 36 time period, nothing alarming. But post that, and it's consistent, obviously that's concerning. Duration of the flow, as we talked about, if it's only lasted a day, maybe worth talking to your doctor about. If it's more than that 7th or 8th day, and then we had talked about earlier as far as volume. And so when we say changes in hemodynamic status, meaning that if it's causing you to become lightheaded, fatigued, the point where you're getting dizzy standing up because you're seeing just, soaking through 3 to 4 pads a day. God forbid if you're soaking through a pad an hour every hour for at least 3 hours, that's very concerning. You don't want to wait to see the doctor tomorrow. You want to call them to get into the same day, or come visit us at the emergency department. So when we think about the causes of bleeding, we think about different age groups. The most common reason for women who haven't had puberty is there a foreign body? Is there a trauma to that area? Whereas those women who've underwent menopause, we think about, when I say atrophy, meaning that there's, I would say shrinkage, if I guess I can say it that way, of the vaginal tissue that can cause that as well. And obviously more concerning is that if there's some type of mass or cancer within the lining of the uterus causing that. And the biggest group would be those women of childbearing age, or what we call reproductive. Once again, that could be, is there bleeding or spotting when you ovulate? If you're having pain between your cycles, that requires more in-depth testing as well. And moving along with that reproductive, could there be inflammation? Could there be what we call polyps? Could there be a possible cancer? And so there's a lot of other anatomical causes of that bleeding that requires further investigation as well. So moving on to the next slide. It's very busy, but the American College of Gynecology and Obstetrics, they created this phrase for us physicians, which is on the left-hand side. It's called palm, like the hand, and then coin, which isn't spelled traditionally like a coin, but it kind of gives us a mnemonic as far as us healthcare professionals of what to think of is when a reproductive, generally a woman in either their postmenopausal or reproductive state is coming in with what we call irregular vaginal bleeding. And so kind of walking through that, when we think anatomically, like certain polyps or certain masses, that can cause that. Obviously, a cancer can be potentially cause that. Is there any type of irregularity as well as far as how the blood clots, which is called coagulopathy, can cause that? Is there any hormonal abnormalities, and that's why there's ovulatory dysfunction? Is there any what we call iatrogenic, meaning that is there any specific medications? Very commonly, birth control options like an IUD or even one that's placed in the arm very commonly can cause abrupt changes in hormones that can cause some bleeding as well. And once again, is there anything as far as the endometrium? And that goes back to anatomical issues. Now, even with all that said and done, at the end of the day, even if everything is normal, unfortunately, that's when it goes into that not yet classified, meaning that we haven't really come to a conclusion of what is really causing the bleeding. And so based on those tests is when we have to go around certain steps as far as investigation, meaning that, once again, blood work, ultrasound, radiology testing, and that'll kind of help us delineate what type of treatment options there are. One thing as far as Pap tests, and we're not on that conversation, but one thing is that in the medical society, we've noticed that cervical cancer is a very slow growing cancer. So now I believe the most current recommendations are, despite when you're sexually active, I think that the first start date is 21 years of age. So by the age of 21 is when we first recommend doing that testing. I believe that is the end of my presentation. Okay, great, thank you.